Chapter 6, Lipids SC5. Now, we do know that there are significant benefits associated with ingesting omega-3 fatty acids. And what we do know is if we look at about 8 ounces per week, intake of these omega-3 fatty acids can reduce blood clotting abilities and also may favorably affect heart rhythm in some individuals. Now, these are really good effects that help lower the chance of having a heart attack. Now, larger intakes of fish, 4 to 8 ounces per day, further reduce the risk of heart disease, and the impact here is to lower blood triglyceride levels in those that have high. Now, we do know, however, though, that there is a risk associated with an excessive intake of omega-3 fatty acids. And what we're looking at here typically is going to be due to supplementation. It is very difficult to consume these levels naturally. Now, what we do know as the negative impacts of this excessive omega-3 fatty acid ingestion are an impaired immune system, the potential for uncontrolled bleeding, and also hemorrhagic stroke. So I think it's important for us to keep that in mind. Now, another thing that's important is the imbalance in omega-3 and omega-6 fatty acids. The typical American is consuming 20 times more omega-6 than omega-3 fatty acids, and they compete for the same metabolic pathways. And because that's the case, this may result in the worsening of inflammatory diseases. Now, another concern that is related to fat intake are rancid fats. So these are fats that actually have gone bad. And the issue here is they contain peroxides and aldehydes, and we know that these are substances that can damage cells. Another thing to keep in mind here is the fact that double bonds in polyunsaturated fats are easily destroyed. Now, manufacturers have a number of steps that they take to prevent the process of rancidity. This is where hydrogenation comes in, sealing foods in airtight packages, and adding antioxidants or other additives. Now, when we look at hydrogenation, remember that's typically how trans fats are formed. But this process of hydrogenation was actually originally developed to increase the shelf life of baked goods for this particular reason and preventing them from going rancid. Now, we have addressed the fact that trans fats are an issue. I've talked about this previously, and I don't often use the term bad when it comes to nutrition, but saturated and trans fats do fall under that category. We are well aware that diets high in trans fats will raise blood cholesterol levels, and we do know that that increases the risk for cardiovascular disease. It will lower HDL levels, and remember, that's the good cholesterol, and also we're going to see an increase in inflammation. So there are a number of strategies to keep in mind with regards to when you're going out to eat and minimizing the ingestion of trans fats. So certain foods that you should avoid are foods that are fried, pastries, flaky bread products, and cookies. So they tend to be high in trans fats. At home, you want to substitute with vegetable oils, a softer tub or squeeze margarine, and applesauce or fruit purees. Now, one of the things that I do, and I call this, I've made this up, this is the spread test. And if you look at hard margarine, that is relatively high in saturated fats. As you get to these softer tub margarines, what you're starting to see is those are not as high in trans fats. So if it's easy to spread on your toast, you're probably looking at a pretty decent hydrogenated oil. Now, if it actually tears up the toast because it's firm and hard and not melting right away because of its hardness, you're probably looking at something that's more hydrogenated and a greater concentration of trans fats. Now, if we look at the overall health risks associated with diets that are high in fat, in particular, we're concerned with obesity, cardiovascular disease, and there's 3 cancers in particular that have been tied into diets high in fat, and those are colon cancer, prostate cancer, and breast cancer. Now, The next couple of slides are going to be focusing on cardiovascular disease. And I think it is important for us to understand that cardiovascular disease is the major killer in the United States. We do know that diets that are high in fat, especially saturated and trans fats, significantly increase the risk of cardiovascular disease. Now, keep in mind, cardiovascular disease is the major killer of males and females in the United States. Okay? Now, men tend to present earlier, whereas women will see an increased risk associated with menopause when they are no longer producing ovarian estrogen. And there is significant evidence that this estrogen is protective. It results in a healthy lipid profile, lower cholesterol levels, increased good cholesterol, lower bad cholesterol. And when women go through menopause, this is actually reversed. So they catch up with males after menopause. Now, also remember, we're talking about a chronic disease, and it actually takes years for symptoms to actually develop. If you are actually experiencing symptoms like chest pain, those types of symptoms, you're probably looking at blockages of 90% or above, because that's how big the blockage has to be before you actually experience symptoms. So if you are experiencing symptoms, your disease is very progressed. Now, it all starts with, as we've talked about before, damage to a blood vessel. Now remember that inner lining of the blood vessel is a simple squamous epithelial layer, and there are a number of different things that can cause damage. Smoking, diabetes, high blood pressure, homocysteine levels, low-density lipoprotein, viral and bacterial infections, and also blood vessel inflammation. So we refer to this as response to injury, which actually promotes the disease process or the formation of plaque in blood vessels. Now, as noted before, this plaque forms and thickens over time. So the arteries actually harden, they narrow, and they become less elastic. Now, there's two different types of plaque. We can have a stable plaque or an unstable plaque. Now, stable plaque is probably going to stay there. Unstable plaque, kind of imagine a scab that becomes loose at the edges. And then toddlers in particular, they want to pick that scab away. And this is what happens. Remember, you're talking about something that is lining a vessel, and it creates a turbulent flow. So the fluid moving through the vessel actually gets underneath that plaque and dislodges it, and you now have a clot. And that clot will actually block the flow of blood, and that's what actually can cause either a stroke or a heart attack. Now, when we look at risk factors, we break them down in two ways. We look at them as being non-modifiable or modifiable. So when we look at non-modifiable, we're really looking at those that we don't have a lot of control over. If we were meeting face-to-face, you would probably say on a regular basis the saying that I didn't pick my parents well. And so that's where we see a lot of the non-modifiable risk factors as far as genetics. So age over 65, so as we get older, we have an increased risk. Males, as I indicated already, have a greater chance than women, but women catch up to men after menopause. If we look at genetics, so a close relative who died prematurely of cardiovascular disease increases the risk. My father died at the age of 63, and I think that's relatively young these days from complications associated with cardiovascular disease. There also are some races that we know in which have an increased risk, and those would be African. And one of the things we know about those of an African heritage is a greater prevalence of hypertension. If we look at Hispanic, Latino, Native American, Native Hawaiian, and some Asian groups. So these tend to be genetic populations where we see an increased risk of developing cardiovascular disease. Now, we want to take a look at those that are modifiable. And so now these are things that we have some impact either through diet, exercise, lifestyle, and other things. So let's take a look at those. Having a total blood cholesterol level, these are the bad things, okay? So having a total blood cholesterol level over 200 milligrams per deciliter and a corresponding LDL above 160. Blood triglyceride levels over 150 milligrams per deciliter. High blood pressure, smoking, and this next one I think is really important, physical inactivity. There was a report published last year, and this report actually puts physical inactivity at the same level or worse than smoking behavior. So to me, that's very significant to put physical inactivity at the same risk level of smoking. So obesity, diabetes, liver and kidney disease, and also lower thyroid levels. So those all are what we consider to be modifiable risk factors, meaning we can manage them with our lifestyle behaviors. Now here, I'm going to point out a couple of things, and generally you want to be familiar with some of these numbers. So you definitely want to know total cholesterol levels desirable is less than 200. And I'm picking numbers that kind of make sense, okay? If we're looking at optimal levels for LDL cholesterol, that should be less than 100. If we look at HDL levels, we actually want those to be greater than 60 if possible. And triglycerides, the optimal level is less than 100. So I've picked those levels just because those are pretty easy numbers to remember. So total cholesterol, less than 200. LDL, less than 100. HDL is the only one that's not 100, and that's greater than 60. And triglycerides should be less than 100. So those are the optimal and desirable levels for lipid levels in our body. Now, when we look at how we should be assessing cardiovascular risk, adults over the age of 20, they should have fasting blood lipoprotein profiles done every 5 years. And keep in mind, when we're looking at some other behaviors, total fat intake should be 20 and 35%. Saturated fat intake, the desirable goal is less than 7. Now, these are the more aggressive goals set by the American Heart Association. Keeping trans fat intake low, polyunsaturated fats under 10%, and monounsaturated fats under 20%, and trying to lower your cholesterol intake to less than 200 milligrams per day. And this can generally be achieved by staying away from saturated fat, meat products, things like that. Remember, cholesterol is strictly an animal product and not something that we find in plants. Now, if we look at some other ways that you can actually prevent cardiovascular disease, including some plant sterols in your daily diet, moderating sugar intake, and this is going to be geared towards decreasing the amount of empty calories. We should be taking more fiber, and that should be a soluble fiber, up to 30 grams per day, making sure that you have an optimal body weight. And this is going to entail increasing physical activity. And notice I'm not using the term exercise. I think physical activity, because once again, it's not formal. Exercise we consider to be a much more formal behavior. The intensity is at a higher level, and so on. One of the things that some of you may have a smartwatch. I actually have an Apple Watch. And one of the things that they try to get you to do on their activity scale is closing your rings. And you have rings related towards standing. You have a ring towards exercise and overall calories expended. So that's a good way to kind of keep track of physical activity. We all know that we should be consuming more fruits, vegetables. Our protein should be more plant-based than it is. And those are important strategies that are very beneficial to decrease the risk for heart disease. Also, the intake of antioxidants. So these are primarily vitamin C and E. Now, if we look at the symptoms of a heart attack, and it really is important that if people are experiencing these symptoms, they should seek medical attention right away. Now, women do present differently, and I'll get a little bit towards that after I've gone through this general list of symptoms. So if we look at shortness of breath, and probably the most positive is an intense, prolonged chest pain or pressure, what you may experience is referred pain, and this actually historically will extend into or down into the left arm, up into the left jaw. That's classic referred pain. If we look at sweating, weakness, nausea and vomiting, dizziness, irregular heartbeat. So all of those are very well-known symptoms. Now, women, as I said, present differently. Quite often, they experience what's known as a coronary spasm. And so this is not an ongoing, consistent pain. It comes and goes. So it's definitely much more difficult to identify a woman that's actually having a heart attack than a man. Now, if we look at stroke, it's also important that if you experience these symptoms, that you actually seek medical attention pretty quickly. So the hallmark symptoms of stroke are numbness or weakness experienced in the face, arm, or leg. If you sense confusion, or you actually have trouble speaking or understanding, trouble walking, so dizziness, loss of balance, problem seeing things, and also severe headaches. So these are all the classic symptoms of a stroke.